This is the Skin Science Podcast. I'm Dr. Thomas Hitchcock, and here we'll investigate everything skin science and dissect it from a scientific perspective, analyze it from a medical perspective, critique it from a consumer perspective, and give insight from an industry perspective. Hello, everyone, and welcome back to the Skin Science Podcast. I am Dr. Thomas Hitchcock, and with us in the studio is Angela Wilson McDonald. How are you doing, Angela?
I'm great. How are you, Thomas?
I'm good. And also our featured guest today, the friend of the podcast, Dr. Doris Day. How are you doing, Doris?
Doing great. So good to be back.
Wonderful. And I love your hair. It's growing out. I think you and I are the same. We like to do different things with our hair, and so we like to keep people guessing.
That you do, Thomas.
All right. So
absolutely.
Yes.
Goes short, goes long.
Yes. And so I don't think we need much of an intro for Doris. Doris has been on before. Like I said, she's a friend of the podcast. She's a clinical professor, associate professor at the New York University Langone Medical Center. She also has a radio show on Sirius FM. And what is the channel, Doris?
110.
110. So it's called Dr. Radio. Yep. And so she does that twice a month. I've been fortunate enough to be on that a couple of times. It's always a great show, lots of interaction between call-ins and such. So if you get a chance, check out that show as well. Really quickly, what we're going to talk about today is rosacea. And Doris has plethora of knowledge on rosacea, and so we wanted to pick her brain about what it is, what the latest and greatest is about how to treat it. But before we do, really quickly, science is a puzzle, and that's why I love mechanical puzzles. And this is the one that I'm going to present this time. This is called the Dial Case by Juno, an Australian designer. It's really cool. Check it out if you like puzzles. And let's dive into rosacea. So, Doris, rosacea, what is it and what is it not? Because I think some people confuse it with other things.
Yeah, rosacea is a bit of a puzzle, really. So that was a good segue right into puzzles. Mm-hmm. And rosacea is an inflammatory condition. We don't really know the exact underlying cause, and there's a bit of a contentious debate amongst us dermatologists. But what we see in rosacea is that it tends to be something that you grow into. It's not something that you have as a child that will just progress as you get older. And even though it's a chronic condition, it's something that usually begins in about your 20s, 30s, 40s, and up. And sometimes, I think now when we look back, we'll see children who may be prone to it, but it's not something we classically diagnose in childhood. And there are several different types of rosacea. We can have acne rosacea, where you get the pimples that look like acne, but you don't get the blackheads and whiteheads that you typically see in acne. So that's one type of rosacea. There's a telangiectatic rosacea, which is where you see the redness, the flushing, and the broken blood vessels. There's a type of rosacea called rhinophyma. It tends to be more common in men, but can certainly happen in women. That's a bulbous, full nose that kind of looks globular. We always think of W.C. Fields when we think of rhinophyma. And the last type is ocular rosacea, and it actually can cause blindness if left unchecked. So one way that we can tell that somebody has ocular rosacea is if they have a gritty feeling in their eyes, and also a lot of chalazions or styes and blepharitis. So all of that, if it's chronic, can be a form of rosacea. Now, the thing about rosacea that's different than acne is that we don't typically think of it as a bacterial underlying cause the way we think of acne. And you and I both know that the underlying acne driver and blaming it all on C. acnes is not fair, and we're trying to change that. But with rosacea, it seems to be more inflammatory, and there are known environmental triggers. Extremes in temperature is one. So if you go and it's super hot as it is here today in New York, 95 degrees outside, and then you go indoors and it's freezing, or you're exercising, you go from extremes of hot to cold. Alcohol, drinking alcohol is a big trigger for rosacea, and especially rhinophyma. And then some spices can be a trigger. So our main triggers are stress, alcohol, extremes in temperature, and some spices. I always say people have their own personal triggers. I had one patient where it was white chocolate. It was this incredible trigger for her rosacea. Mine is vinegar. So vinegar is a problem for my rosacea, eye flare. And you can kind of see it the next day. Now, the contentious little debate amongst us dermatologists, where we, us nerds in science, is there's the Demodex theory of rosacea.
Yeah.
So one group of dermatologists feel that the Demodex, little mites that live in your skin, when they overgrow, they can cause problems that lead to rosacea. The other group says, no, Demodex are just a red herring, and Demodex is not the problem. Targeting them doesn't make sense. But if we look at the treatments that we have for rosacea, they tend to be anti-parasitic, not so much antibacterial. Sometimes we use some antibacterial topically or even by mouth, but more for the anti-inflammatory effect. But typically we use metronidazole, which is topical flagyl, or topical ivermectin, or topical sulfa-based agents, those things that will help reduce the effects of parasites or mites in the skin. And they do a great job of helping to control that rosacea.
Okay, well, you just gave us a whole textbook in 5 minutes. So let's break it down a little bit, because we have those two types. The what is it called? Papulopustule, the one that you called acneiform type of rosacea, and that one is the one that often I have people in our clinic when we do studies and such. They come in, if we say you have acne, come into this study, and they come in, they'll have rosacea, not acne, and so we have to turn them away and then put them in another study or whatnot. But the other one I think is interesting as well, because as you mentioned, they're all linked to inflammation, right? So the real question, what's triggering the inflammation? And so there is some research that shows there's certain genes and phenotypes associated with this type of immunomodulatory or autoimmune type of issue. And so this is also something where people, I wonder myself, is that are there certain genetic markers that predispose people to something like even acne or rosacea or psoriasis? We know it does. We know there are certain genetic markers.
Sure.
But the thing is, the reductive nature of saying this Demodex or this bacteria causes this disease state, when we start to realize that there's more pieces to the puzzle, then it makes you rethink, how do you truly need to treat this disease? And so one of the things you started listing out was antibiotics and such. And so the real question is, you mentioned it was for possibly more anti-inflammatory, the anti-inflammatory effect versus the antibiotic effect, maybe a little bit of both. But the Demodex also, do you know what feeds the Demodex? Is it the yeast of the skin? Is it the oil? Like, do you know? I'm not sure if I know.
If what? The Demodex?
What the Demodex eat?
Oh, Demodex, what they eat. I think they eat the skin.
Like the keratin? Oh, hold on. You're frozen just a sec.
Yeah.
All right, say that one more time. You froze a little bit.
I think they just eat the skin cells.
Okay, so like the keratinized skin cells, they'll eat those. So, because some of the thought I had is I wanted to look it up before now, but I didn't. And maybe, Jose, if you have a chance to look at, see what Demodex, if there's any latest and greatest research on that, we can see. But my thought was, because I was reading this review article of kind of the latest, greatest on rosacea, and they're talking about, like, there's certain bacteria that are more associated as far as, here, let's say, for instance, the certain phyla, so actinomyces accounted for only 1/10 of all clones in papulopustular, but then the other form of rosacea that's more the blood vessels and the redness actually had almost all of that phylum. And then conversely, proteobacteria and firmicutes, which are other types of phyla, made up a lot of the redness type of rosacea versus the pustular, which is lower amounts of those phylum. So obviously not obviously, but there seems to be, based on research, some association of certain phyla or certain phylum, certain species even. So apparently staph epidermidis is seen as a trigger, which is supposed to be skin commensal, but as you and I know, it's strain specific, not species specific. And so it all becomes a little more complicated, but then the real question is, if we kill the bacteria And the bacteria is like, for instance, C. acnes keeps yeast down. So if we use a broad spectrum antibiotic topically or systemically, and we reduce the overall amount of bacteria that causes the body to produce short chain fatty acids, which keeps yeast down, and yeast, explode a little bit, does that change the way the Demodex work? And so the real question is, we don't really, like you said, it's a little controversial what the culprit is, but there's a chain of events, and some of these methodologies could be limiting that chain. So is it everywhere in the chain we got to stop, or is it one place in the chain? Is it just the Demodex? Is it just the bacteria? Is it just the inflammation? Or is it all three?
You bring up such a good point, because so much of what we do in both acne and rosacea is we try to just make it look better instead of trying to really fix it, right?
Mm-hmm.
So when I have patients who have rosacea, I go over the triggers and things that I believe they have control over. We talk about the importance of certain dietary changes, and kind of maybe sometimes even keeping a diary if it's bad enough, to see if we can point to what could be exacerbating it for them. But antibiotics do work for the acneiform type of rosacea. And we even use something called Oracea, which is a very low dose doxycycline. It doesn't have an antibiotic effect. It has a pure anti-inflammatory effect.
Mm-hmm.
And it does help a lot with ocular rosacea. When I put my patients with rosacea of the eyes on it, it's not, the reps don't teach the ophthalmologists about it, and they don't learn about it in training. So many ophthalmologists don't know about that medication. But when I put them on that, they say, well, they've tried everything else, and this is the only thing that works.
Right.
Many times. So there is a role for that anti-inflammatory component. And maybe if it's a genetic driver and there's enough going on in the world, we need the long-term treatment for it. But I think trying to understand, as you're doing, the source of it. What is it? The strain? Do we need to rebalance the skin biome, strengthen certain strains of C. acnes to keep the other elements at bay and help the skin do its own job the best? Your skin will do better that way in the long run than just throwing things at it,
right,
to try to annihilate everything on it and hope that holds you for a long period of time.
With the anti-inflammatory idea, that's really the crux of a lot of the skin issues, right? Is whether the body is taking something that should be living on the ecosystem of the skin and reacting in a weird way to it. It's like the whole thing behind psoriasis, as well as that the body's reacting to stuff it shouldn't be reacting to. And it's about controlling that. But the real question is, what's causing that overreaction? Is it simply a genetic thing, or is it caused by, like you said, a dysbiosis? And it's a bigger puzzle than I think people give. They're trying to say this biologic, which I do want to ask your opinion on biologics for rosacea, but this biologic or something can squish it. But then what is that biologic doing? What are these antibiotics doing? What are these anti-inflammatories doing? And so there are certain things that are a little less, they're going to cause a little less of a side effect than others. But the real question is, like you said, we don't want to just slap a Band-Aid on something. We want to try to address root causes, which is, why is your body overreacting to certain things? So what is your feeling on the use of systemic biologics for rosacea?
For most rosacea, I don't think that it's anything that is useful or necessary. I mean, I always worry about anything systemic in general, that or any medication that someone was going to have to use over a long time. But there are some cases of very severe rosacea where it might be helpful. But for now, I think most of what we do for rosacea, by being aware of triggers and most of the medicines we have, and then devices, using things like broadband light, certain lasers to reduce the redness and sort of take it back a notch to more normal, does a great job of helping. So I don't know that we need something totally different for this. And I would certainly be careful about any side effects of anything systemic.
Yeah, and so I'm with you there. Systemic stuff should be kind of last resort, in my opinion, when nothing is, and your quality of life is really low or whatnot. But regardless, that's pretty extensive as far as what rosacea is, how it's kind of under control and treated. I know that there's other things that are being explored, like I think benzoyl peroxide is being explored. But remember, a lot of people equate things like benzoyl peroxide with antibacterial, but really it's actually more antifungal, and it does have anti-cherolytic and anti-inflammatory properties. It's a free radical. So there's a lot more, just like Doris was saying about antibiotics, is some antibiotics have multifunctional, aspects to the way that they work. And if you use a certain dosage, it does something very different than when it does at another dose. And I think that's one of the things people forget in skin. And especially when we have thousands of formulas out there, if it has an ingredient that is good for you, it could change if it's good for you based on how much is in there. And so I don't know, Doris, if you want to take this to, and in a second, we're going to go to Angela, because Angela's actually a person that lives with rosacea, and she does very well in managing it. But I'd like to hear, Doris, a little bit from you right before we talk to Angela about this, about what you observe with your patients when it comes to what they put on their skin and whether that's contributing to rosacea, because I have seen that even with my experience, that people use 11 different things on their face and wonder why they have rosacea. So what's your thoughts on that?
Well, a lot of things can look like acne and can look like rosacea. So in somebody who's using a lot of very harsh ingredients and layering them or over exfoliating, they can have an irritant dermatitis which is a irritation from all those products. And that can look like rosacea, but actually just stopping the products makes it better. So I want generally more calming ingredients and maybe not layering so many things. So I've kind of become more of a fan of one product that has more ingredients than 5 products that each have one ingredient, because it's less preservative. And usually those ingredients have to be tested together. And so they're not going to interact or even create a bigger problem in the skin.
Right. At least one would hope, right? Not every company tests their products as robustly as others. But yeah, I agree with you, is because people also don't realize that when you put multiple topicals on, like if one's vitamin C, one's vitamin A, one's vitamin E, that's great. You have vitamin A, C, and E, but you also have all the carbomers, and you have all the film formers, and you have all of the preservatives, and all of the emollients, and all. So you're basically layering other ingredients that you're putting too much on now. And so, I think that's where people go a little awry. They say, I need all these ingredients because Dr. Day said these are important ingredients, so I'm going to get 11 products. And I'm glad to hear that you're kind of saying that might be true, but you need to find less product that has the things that you need. And also, I think it's also, what is your feelings on all the hype stuff that people use and then they get reactions to it? So, for instance, bakuchiol was a big thing previously. And then there's always like a hot, like right now, the big thing is exosomes, very controversial because it's a generic name for something that is very diverse within biology. And people are just slapping this stuff on without even knowing what it is. And what is your feeling about, like, what would you say to a patient that says, I got rosacea, how can I take care of it? And you find out that she's using a product that has something that is an ingredient that hasn't been really vetted out. And they say, but I don't want to get rid of it because it makes my skin so soft or something like that. Otherwise, what do you say to those people that don't want to get rid of these products that they like because of the hype, but they have issues with their skin now?
Well, it's a lot of it comes down to conversation and education and sort of explaining what those ingredients might be doing both to their skin biome and their skin. And just as our conversation goes, talking about the layering of the vehicle ingredients and the preservatives and how that might be even more of a problem than the active ingredient. And a lot of ingredients that are hyped as new really aren't new. They're just sort of repurposed.
Yeah.
And what I have them bring in all their products. I like when patients do that. And then we'll start with like taking things away and then adding them slowly back as their skin tolerates, so we can figure out what really works for them. And I think when you explain to somebody why you're making a recommendation and you can have some science to back it up and help them understand where you're coming from and what it could be doing to their skin, I don't get much pushback. Yeah. And and I'll go and research. And when it comes to exosomes, I think exosomes are very exciting, but like you said, exosome is just a delivery. It's an extracellular vesicle. It's what the payload is. It's like what is in that exosome. So exosomes are neither good nor bad. unless it's what you pack them with.
Right.
So they can be great, but they can also be harmful.
Right.
And so knowing the source of the exosome and how it's packaged is really, really, really important. But I think that is an exciting new frontier in skincare.
Yeah, I agree. So we are running short on time, so I want to get to Angela. So Angela, you have diagnosed rosacea or self-diagnosed rosacea?
No, actually diagnosed in my mid-30s. And something I haven't heard today, Doris, and your thoughts on this, does stress play a factor? Because when I got diagnosed, I had just delivered my twins. I was using a glycolic acid range at the time, MD Forte, if you remember MD Forte, I'm sure you do. But I was using that product in particular, and I had been using it for a long time without any concerns, and all of a sudden my skin was flaring, and I did see a licensed dermatologist and was diagnosed with rosacea at that time.
Okay.
Is that
so
common?
Stress was one of the first things I mentioned. Stress,
She did
alcohol,
mention
extremes,
it.
and temperature, and some spices. but I didn't focus on it because I was really talking about the nutritional side of it. But
Right.
stress is a huge thing. And stress, what I try to tell patients is that it can be good or bad stress. I mean, you had children, that's so exciting, but it's still a stress. Getting married can be a stress. All sorts of good things can be stressful. And what I try to talk about is how we can look at stress as a puzzle rather than things being the end of the world. Like a lot of times when things happen, people stress instead of saying, wait, I got this. I've done this before. I can get through this, and sort of taking a look at things a little bit differently. I always feel like when you see something in your skin, when you have a rash or a flare of rosacea, your body is telling you need to do something different.
Right.
Right. And so that's why I don't like just putting a cream on it and say, just use this cream and go, it'll get better.
Right.
What I try to do is say, okay, well, your body's telling you something. Let's try to think about what it's telling you, what we're going to do differently so that these medicines will work better. You won't need them as much. And next time we can avoid this flare. I mean, childbirth you can't avoid, obviously, but you know what? I bet if you give birth to more children, I mean, I hope you don't avoid it, but as you give birth to more children, you go, oh, wait, I've given birth before. I'm going to be okay. This is kind of fun. And then I'm going to have this baby and it's okay. So if we look at it and use all of our tools to help, so talking about diet, the stress,
sleep,
what we're going to do for the skin, sun protection, managing extremes in temperature, looking at the products you're using, what could be exacerbating, because even around pregnancy, women use different products than they do when they're not pregnant.
It's true.
And those could be a problem sometimes. So even something like hyaluronic acid could be an issue in some people. So I think it's putting it all into context and helping patients help themselves and not feel like they're just going to stress, it's going to happen, and I need a doctor to give me a cream every time I stress.
Yeah, speaking of stress, I did read that beta blockers can be used for rosacea, and that kind of feeds into, with temperature, you have vasodilation. That's why we get red, and because we're trying to release heat. When we're stressed, we have high blood pressure, which can cause certain things in our cardiovascular system. So the beta blockers, I mean, if that's successful, that's telling us that there's something that's happening that is outside of the realm of even the skin microbiome or the gut microbiome, or there's more to it than even the immune system.
Lowering stress, right? So it's your heart rate goes up when you're stressed. So some people, like before they give a talk in public, they get so anxious and they take a beta blocker because it lowers their heart rate,
calms
and
them
so
down.
it calms them down, and so that may be the connection. I'm not sure, but again, like beta blocker is a real drug. I try not to use things that could have other side effects.
100%, yeah.
Or a Band-Aid. It's like, it's a quick fix, but sometimes you need that, and it's okay. But in the long run, if we can figure out other exercises that could do the same thing and give you that same response without the medicine, that's what I aim for.
Yeah, I think that's wise. And of course, I feel the same way. So, Angela, what have you tried, or what have you been?
Oh, I'm just want to be very honest. The fact is, I feel like now with our new product launch that my skin is more in balance.
What new product would that be?
We've never mentioned it before, have we? But no, with BioJuve and the Zycrobe technology, I do feel like I have less flares, that my skin is more balanced as a whole. And it feels like kind of going back to what you said previously, Doris, about what products I was using and maybe putting the wrong thing on at the wrong time and having flares. I don't feel that anymore. I can feel in stressful situations, I can feel my cheeks actually tingle and feel warm. And I know just exactly what you said, Doris. I know in those moments, okay, let's dial the stress back at this point. You know, I can feel my cheeks flaring. It is kind of a signal to me, but I don't use anything for the treatment of rosacea anymore.
Have you guys ever seen the movie Clue back in the day with Tim Curry where the woman's like, I can feel flames on the side of my cheeks. So when you're speaking, that was what I was thinking about.
That's what it feels like. It feels tingly. It feels hot. You can literally feel, I was like, I know I'm flaring right now. The blood's
going there, yeah.
I know I'm flaring right now.
All right. Well, Doris, thank you so much for taking the time to speak to us today about rosacea. I think that most people, are still a little bit confused because of just the similarities with other things, like you said, like dermatitis and acne and such. So as always, everyone who's listening, if you are a non-physician, please see your physician to diagnose this properly, to make sure that they're doing the right thing. And Dr. Doris Day, I would listen to what she says over pretty much anybody else. So the fact that she and I agree on the fact that, less is more approach, try to do things holistically versus, just slapping a medication Band-Aid on something, if at all possible. I think that's wise and advice there. So, Doris, do you have anything you want to plug before we jump off?
No, I think, everyone should read our book, Rebooting the Biome, because we have such great stories there. So
I agree. Hold it up.
And I also,
yes,
so I have it right here, Rebooting the Biome.
Yes.
A great book. Thomas and I wrote this, and it took us a long time, and we tell such great stories, and there's great advice. You'll really understand why we make the recommendations that we do, and it also helps you understand why BioJuve is such a great product. I mean, my patients are loving it. My rosacea patients love it. It's been such a game changer for my practice, and I'm really happy that you helped create that line.
That's a great endorsement, and just so everybody knows, Doris was watching me every step of the way for the last decade plus, and it's one of the reasons why we co-authored the book together, because we've kind of grown together in this field. So anyhow, Doris, where can they find you on social media?
I'm at Dr. Doris Day, Dr. Doris Day, on Instagram, LinkedIn, TikTok, Facebook, you name it. It's my website, Dr. Doris Day, across the board. Can't miss me.
Yeah, and she has great stuff. She has lives all the time. She's very eloquent. You guys should follow her if you haven't already, but given the number of people that follow her, you probably do. Doris, where could they find you? Not Doris. Angela, where could they find you?
Instagram at Angela Wilson McDonald.
Okay, and so she has about 3 posts up now. So
I think I'm working on number 4.
All right. Well, and you can find me at dr.t.hitchcock on Instagram. Just go there and you could probably get in contact with me, or you can go to crownlaboratories.com and look up at the medical affairs site. There's all sorts of videos. We have a series called Beauty and the Bacteria and all that. You can take a look at that. So I think that's it for today. So we hope that you gleaned something from this conversation. Thank you for your eyes and ears, and we will look forward to seeing you back on the next episode. Goodbye for now.